In December 2019, China notified the World Health Organization of several cases of human respiratory illness, a disease later named COVID-19. The virus causing this disease is known as severe acute respiratory syndrome coronavirus 2. The disease spreads through small droplets that are expelled from the nose or mouth when a person with COVID-19 coughs or exhales. Therefore, standing close to someone who is infected can put you at risk. These droplets can land on your hand and be transmitted through something as simple as a handshake, if afterwards you touch your eyes, nose, or mouth, the so-called T-zone. The virus is known to survive on different types of surfaces, so touching these contaminated surfaces and then touching your T-zone brings a high risk of infection. What we know so far: the coronavirus is spherical in shape, and its genetic material is encapsulated by different types of proteins. Some of the key structural ones are spike S protein, the most prominent feature of coronaviruses from where they get their name, then M, or membrane protein, and the so-called envelope protein.
Tell the patient what they should expect during testing procedure. Have them start by blowing their nose if they have excess secretions. Ask the patient to tilt their head back slightly and close their eyes to help alleviate discomfort. Place your non-dominant hand behind the patient's head to keep the head still. Hold the swab like a pencil closer to the breakpoint so that the shaft of the swab does not bend. Insert the swab into the right nostril, angling the swab slightly up and out so that it is directed toward the outer cheekbone, just below the outer corner of the eye. This way, the swab will reach the top of the mid-portion of the lower nasal turbinate toward the middle meatus. The swab should be inserted approximately 2 to 2.5 centimeters, just less than half the distance to the red line or breakpoint. Rotate the swab for 5 seconds in this location along the side wall of the patient's nose. Try not to rotate the swab along the septum or middle wall of the patient's nose. Repeat this procedure in the opposite nostril using the same swab. Place the tip of the swab into the viral transport media tube and cut off the applicator stick.
Youth are the backbone of the nation. They can change the future of the society with their well-being and courageous behavior. The key role of youth in society is to renew, refresh, and maintain a civilization. The future careers of our generations uphold how we manage to survive in the community. The beliefs we are holding to, the practices we outgrew from, is what the nation can expect from us. We are the initiators of movements for a better progress of the society or community. As a student and soon to be registered medical technologies, during the COVID-19 pandemic means putting up the effort to wear a mask, social distancing, and staying at home if symptoms arise. Helping the community members in need and setting an example of good citizenship with peers are some of our important roles in the community. In order to end this pandemic, a medical technology student must go above and beyond the typical standards of good citizenship to do anything they can to protect their communities from COVID-19.
COVID-19 is a disease caused by the new coronavirus. Know the symptoms. They include fever, coughing, muscle pain, shortness of breath. What can you do? Wash your hands frequently with soap and water for 20 seconds or use an alcohol-based hand rub. Avoid touching your eyes, nose, and mouth. When coughing or sneezing, cover your mouth with a tissue or flexed elbow. Discard tissues into a closed bin and then wash your hands. Maintain a distance of at least 1 meter between yourself and someone who is ill. Seek medical help if you display symptoms. Wear a mask if you are coughing or sneezing, or if you are caring for someone who is sick. Dispose of your masks into a closed bin and then wash your hands. Check trusted sources regularly for accurate information. Remember, the best prevention is to keep yourself healthy and follow these safe steps.
Well, still not normal, Still not normal. COVID is still there. But you know that there is a hope, Meron tayong pag-asa that sooner or later, we will go back to normal.
To my fellow Filipinos, please set your fears aside. These vaccines are backed by science and deliberated on by our expert, Filipino expert. I encourage you to get vaccinated at the soonest possible time and be a partner in preventing the further spread of the disease.
Everybody is afraid to go out because of the absence of the vaccine. But with the help of China, and please convey my gratitude, xie to the Chinese government and people. I would like to thank and to travel to China even one day, just to tell President Xi Jinping, thank you.
As a future medical aid person, trained skills can be applied through emergency situations. Some news depicts the heroic act of some nurses and some medical frontliners that are attentive to help people in need. Humanity is what the world needs the most today, and it will start within the community. As a youth, a member of a community, small gestures such as the viral community pantry can help people who are having a crisis because of the severe acute respiratory syndrome coronavirus 2. Macro movements can give a big impact when it is collected. Being a student in these trying times, we can serve the community by showing discipline and comply with the protocols of the community. We can influence others to do the same because by that simple act, all of us can survive and lessen the risk to our community, as well as with the knowledge that we have as a medtech student. We can educate the people so that they will thoroughly understand the safety protocols being imposed and how important it is to stop the spread of disease. Community participation and engagement plays a big role in keeping the community itself safe from the virus and other occurring natural phenomena. Obeying rules is hard for most of the students, youth of my age. The obedience of the community impacts the overall function of the nation. This pandemic, following health protocols and engaging in the new normal, would help the country defeat the virus, especially now that it is still ongoing and getting worse.